All right, well, let's get started. Welcome and thank you for joining us for Improving Outcomes in Rural and Frontier Communities, Perspectives from Healthy Homes and Environmental Public Health Experts. My name is Nicole Dutra. I'm a Senior Project Coordinator here at the National Environmental Health Association, and I will be your moderator today. Here's an overview of today's agenda. Next, I will provide a few housekeeping guidelines for the duration of today's webinar, then share a little with all of you about who is NEHA. Following that, the National Center for Healthy Housing will share some details about who they are and what they do. Then I will introduce our three guest speakers, experts in rural and frontier communities, who will take turns giving their presentations. We will provide an opportunity for Q&A upon the conclusion of their presentations today. And please do stick around for a special announcement towards the end of the hour. And then we will close it out. With that, allow me to cover a few housekeeping items before we get started. Please note that the seminar is being recorded. The seminar recording will be uploaded to NEHA's Healthy Housing in Rural Communities webpage. If you have any questions for our speakers during their presentations, please use the Q&A to submit your questions, and we will attend to them after the presentations. At the conclusion of the seminar, you will receive a link to take part in an evaluation survey to provide your feedback and comments on today's seminar. So now, for those of you who may not be familiar with NEHA, allow me to provide a brief overview of who we are. As an association, everything we do is to build, sustain, and empower the environmental public health workforce so they're equipped and prepared to protect the health of communities across the country. We support environmental public health by continuously providing the most up-to-date training, tools, and resources to the workforce who specialize in so many different fields considered environmental public health. NEHA is focused on increasing knowledge and skills across all environmental health fields to build up our workforce capacity, efficiency, and effectiveness. We also offer credentials to certify the expertise of our workforce. In addition to our large online library of trainings and seminars and available tools and resources, we host an annual educational conference each year, which includes multiple sessions focused on the many different fields of environmental public health, like policy and regulation, extreme weather preparedness and response, food safety, private wells, water quality, climate change, wildfire response and recovery, and so many more. In fact, we just held our 87th annual educational conference this past week in Pittsburgh, Pennsylvania. If you missed it, don't worry, you can begin planning to attend our 2025 AEC, which will be held in Phoenix, Arizona. So if you have not explored what it is to be a NEHA member yet, please do so, because no matter where you are in your educational journey or professional career, NEHA has something for you. Check out our website to learn more. Next, let's learn a little bit about the National Center for Healthy Housing. I'll pass the floor over to Anna Planke.
Great. Thanks, Nicole, and thanks everyone for being here. My name is Anna Planke. I'm an analyst with the National Center for Healthy Housing. The National Center for Healthy Housing, or NCHH, is a national healthy housing nonprofit, and we're based in Columbia, Maryland, so sort of in the DC area. We were established in 1992, so just recently, I guess about 2 years ago, we celebrated our 30th year anniversary. And since then, NCHH's mission has been to transform lives through transforming housing. So our work consists of integrating sort of like this three-pronged approach of healthy housing advocacy, community-based research, and also capacity building sort of under one roof to reduce health disparities nationwide. And you'll see there, our vision is to translate credible science into tools and really focus on systems change. So to do this, we equip leaders in public health, housing, and the environmental sectors with various things like data, tools, policies, and best practices that they can use to improve the housing quality in their communities. Some of the other primary audiences we serve are policymakers, government agencies, healthcare providers, researchers in the academic community, foundations and corporations, and also families and consumers. Next slide. So regarding this work specifically, NCHH has been in partnership with NEHA, with the National Environmental Health Association, focused on rural and frontier communities. Through this project work, our goal has really been to gather information about the current healthy housing needs and challenges in rural and frontier communities, but also to amplify the existing strengths and the unique strategies that are already in place. So we focused on creating new resources, connecting with stakeholders, really speaking to people who are directly engaged in environmental and healthy housing work, in the field, and to really inform future opportunities for cross-sector collaboration and also inform the future role of these two fields in this work. So I've provided a website link there to our main rural website, where you can see the resources that we've developed in the past year, and then also this upcoming year. Next slide. So yeah, just in addition to the main rural healthy housing site, I've just provided some links and some information to our main website, and where you can find us on some other platforms, including Facebook, Instagram, LinkedIn, Twitter, which is now X, and our YouTube channel. And next slide. Yeah, so that's it for me. I'll turn it back to Nicole, and we can get to hear about our speakers. Thanks so much.
Thank you, Anna. All right, now please allow me to introduce today's guest speakers. Today we have Romona Williams, who is a professional community and economic development practitioner with 30 years of experience of working to develop low wealth and predominantly African American communities in urban centers. She currently serves as executive director for the Mississippi Communities United for Prosperity and oversees its daily operations and for the Achieving Sustainability Through Education and Economic Development Solutions model. Ramona's passion for equitable community and economic development and climate, environmental and social justice has driven her life's work to empower African Americans and vulnerable communities with the tools and resources they need to transition their communities into healthy, thriving, and sustainable places. Her work has centered on promoting equitable and inclusive applied research and analysis to impact public policies in community and economic development, consumer protection, education, climate change, environment, health, and social justice. Next, we will have Len Wishart, who joined Albemarle Housing Improvement Program Incorporated in August of 2003 as one of two rehab specialists responsible for inspecting, estimating, and writing up emergency repairs, rehabs, substantial reconstructions, and energy efficiency upgrades. In February of 2006, Len completed the training, qualifications, and testing necessary to obtain the Virginia Lead Abatement Supervisor license and is the qualified individual for AHIP's Virginia Lead Abatement Contractor's License Specialty. Len created and manages AHIP's construction, lead hazard, respiratory protection, and safety programs. He has also completed Earthcraft Builder Certification, EPA RRP Certified Renovator Training, and holds a Virginia Contractor's License. Len began his career in 1986, managing his own construction company, building additions, homes, and performing historical, residential, and commercial renovations. Len holds a bachelor's and a master's from the University of Virginia and completed College of William and Mary Center for Executive Development Seminar on Project Management. And lastly, we have Brandon Kemperman, who is a healthy building scientist with Public Health Seattle and King County in Washington State. He has a master's degree in public health and a bachelor's in environmental science with certifications in industrial hygiene, school risk management, and playground safety. With 17 years of industrial hygiene, environmental science, and public health experience in consulting, academic, and government sectors, he now serves as technical advisor for the Public Health Seattle and King County's K-12 school environmental health and safety program that covers over 700 public and private schools in King County. Mr. Kemperman also serves as the chair for the National Environmental Health Association's Rural and Frontier Committee. When not focusing on environmental health and safety, he loves spending time with his partner and 2 children outdoors in the beautiful Pacific Northwest. Thank you to the 3 of you for being here with us today. We will go ahead and get started with presentations. And first, I will pass the floor over to Romona Taylor Williams.
Thank you, Nicole. Thank you for inviting us to participate in this webinar. We're very excited to share our story here in Mississippi, in the rural communities that we work in, where we got our start in 2017, 2018. And also want to say thank you to the National Center for Healthy Housing, who has been a part of our work in lead and healthy housing since we started looking at the disproportionate number of African-American children and pregnant women who have high exposures to lead and also elevated blood lead levels in Mississippi. Next slide, please. Out of our work that began through MCUP becoming a cohort with Thriving Earth Exchange, which gave us the opportunity to have 5 researchers to work with us to analyze and to look at the Mississippi Department of Health and also the Mississippi Department of Environmental Quality, how they were responding to the disproportionate number of African-American children and pregnant women who have those high exposures to lead. The National Center for Healthy Housing joined our coalition of researchers from the University of Idaho, Southern California, 2 researchers with the University of India, and also the PSOC at Emory University. Out of that work of 2 years of research and analysis came out of the motto that came out of that work is the Mississippi Zero Lead and Healthy Housing Solutions Initiative. Next slide, please. What was the project's purpose? The Mississippi Zero Lead and Healthy Housing Solution Initiative, through that research, has identified gaps in the state's lead poisoning prevention and healthy housing program. And we seek to reduce exposures to lead, elevated blood lead levels in Mississippi's BIPOC children and pregnant women by increasing awareness of lead hazards in homes, retention of children in Mississippi screening and care coordination programs, and advocating for investments in lead mitigation and in the improvement of healthy housing overall and the quality of housing. Next slide, please. Why Mississippi Zero Lead and Healthy Housing Solutions Initiative? In Mississippi, 27% of our children live in households with a high housing cost burden, and 28% of children live in poverty. In many Mississippi communities, the majority of housing was built prior to 1980 and may contain lead-based paint. As high as 77% of housing in our target areas, compared to only 42% of housing built prior to 1980 statewide. Also in 2018, 745 Mississippi children under 6 tested had an elevated blood lead level. 87 had a blood lead level of 10 mgdl or more, but the number of children exposed to or harmed by lead is even higher. An estimated 3,801 children, equivalent to 184 kindergarten classrooms, are exposed each year in Mississippi, contributing to increased costs, a reduced lifetime productivity, and increasing expenses for healthcare, education, and social assistance. Next slide, please. What is our solution? The proposed work of the Mississippi Zero Lead and Healthy Housing Initiative seeks to fill these gaps and equip residents, unlicensed family child care providers, elected officials, and key stakeholders with information about residential and occupational risk, as well as a more complete picture of the impact of lead within our communities, setting the stage for both individual and collective action. We are resolute in our belief that our work will have statewide benefits, but to date have focused our beginning efforts with direct services in specific counties with high need, high risk, and a significant portion of people of color and low-income residents who are subject to a range of historic, ongoing, and emerging environmental injustices. This collaboration has three objectives, which include educational outreach, environmental and public health monitoring, and 5 vulnerable zip codes in Mississippi, as well as efforts to build capacity in our organization and community by fostering and building new partnerships and implementing the objectives of this project. Next slide, please. What is our pathway forward? We're building out as the result of being a grantee of the National Center for Healthy Housing, their rural lead initiative that provided us with $50,000 to build out a strong coalition of diverse stakeholders, also to create our model for healthy housing. We are going to aggressively advocate for public and private investments at the federal and state level, especially for counties to have lead abatement programs. And right now in the state of Mississippi, counties do not have lead abatement programs. So when our children test positive for lead, elevated blood lead levels, they actually go back into the same environments where they were poisoned. And we also want to reduce those numbers of exposure, risk of children and pregnant women through applied research, to influence public policies, improve housing quality, and improve and increase lead testing of paint, soil, and water. Next slide, please. Who are our partners? We are a small frontier organization, and we rely heavily on partners. And it would be literally impossible for us to do the work without the partnerships that we have. And our partnerships are strategic partnerships. So we have a number of key partners from multiple stakeholder groups who have committed to support this work. The Mississippi Department of Health, Lead and Healthy Housing Programs, Mississippi State University Extensions, Nurturing Homes Program, the National Center for Healthy Housing, RTI International, and Thriving Urban Exchange. Next slide, please. And closing out, MCUP's Mississippi Zero Lead and Healthy Housing Solutions team is myself, Larry Miller, who is our Healthy Housing Project Manager, Landra Hunter. We are focusing on developing the workforce in order to do the mitigation work around healthy housing, and also Michelle Rebels, who is our project evaluator. And please feel free to reach out to us with any questions at info@encomp.org, and you can always reach out to me. So that's who we are. Thank you very much. Pass it back over to you, Nicole.
Thank you so much, Romona. Now I will bring on Len Wishart for his presentation.
Thank you, Nicole. And thank you, NEHA and Healthy Homes for having me today. I work for Albemarle Housing Improvement Program. We are a home repair nonprofit. I'm going to show you two large rehabs. Our partners are Albemarle County and the city of Charlottesville. They help fund our operations, and we get funding through the planning district also for home preservation grant money and community development block grants and home funds. Next slide, please. I'm going to show you Nelson Rehab in Albemarle County, where we used HBG funding and private funding, and the Johnson Rehab, City of Charlottesville, with CDBG and private funding. Next slide, please. Here's the Nelson House. It's built in '79, so we don't have to worry about lead. It has a newer roof. You can see the gutter has a sag here and no right side downspout. There was water intrusion around the perimeter of the front and the sides, and there was mold and other issues with this house. Next slide, please. From the side, it looks a little bit worse. They've added siding to the existing siding, and it protrudes past the trim, creating kind of a water trap, and which they've tried to caulk. Next slide. From the rear, the same thing, siding on top. Here at the deck areas, the band was not flashed properly, so water intruded into the wall, the floor, and the basement below. Next, please. Here we have the floor plan. You can see where the deck is, this entire wall. The kitchen cabinets have to be removed and replaced. This entire wall, you could push on it, it would move. So the band and plate were completely rotted out. The rooms below were, with the bathroom, was a completely rotted out ceiling. Next, please. Here you can see that area below. The middle wall, these perimeter walls, all had mold intrusion and water damage, so that we were, the mold contractor has to remove all of the sheetrock, all of the trim, and framing. Next slide, please. The cost of dealing with the water intrusion was about $17,000. This is a single family homeowner. Most of our work is with low to moderate income families and homeowners. This was extra space for him, so we really had to make a hard decision about what we could fund in putting back the basement finishes. Next slide, please. You can see mold growing up the wall. Next. Here you can get a good idea of the amount of trim damage, mold going up the wall. All the sheetrock would have to be removed. The furring strips removed, all the rotted wood removed. Then the contractor HEPA-vacs the walls. Then they treat with a fungicide, and then they have to air seal the entire area and then use a negative pressure machine to keep the occupants protected. Next. Clutter was a big issue with this family. We have to engage the other family members to help clear out rooms that are inaccessible. Next, please. Here, the basement had extreme clutter. The contractor who is doing the waterproofing has to cut the perimeter of the basement floor cement and put in a perimeter drain. Obviously, none of that work could occur without with all the clutter in place, so that has to be removed. There's mold on this furniture here, you can see. Next. Oh, there's a bear. Not the first bear I've seen mounted at a home. Extreme clutter in this area. You can see I could not access this bedroom. Next. Now, clutter, this is often, and hoarding is often caused by some trauma. This man had his wife pass away recently, and he's still dealing with that. Luckily, the family members were extremely motivated. And that's important to have family members come together to help the client deal with this so they can get the work done. Next, please. Outdoor collections were extreme. Now, we're not doing work out there. Some funding sources require cleanup. This one didn't. So, mental health services are expensive. They take a long time. we can't really, we're construction people. We're not in that area of expertise, but we do help the client. We bring in dumpsters as necessary, and we motivate the family members. Next, please. Vermin, rats, termites, rodents were a big problem with this household. We had to do duct cleaning as they found out that rats were running through the duct system. Next. The owner attempted to remove the smell of dead carcasses in the attic with the bleach. We had to get a sort of hazmat, a removal of insulation and carcasses up there at a cost of about $2,000. And insulation was also about $2,000. Here you can see that there was water damage from burst pipes. Apparently the rats, when they're poisoned by the homeowner, they go to water source and they chewed through the water pipes. Next. Also, the chimney failed inspection. The owner used wood heat as a primary heating source. The oil stove, the oil furnace was not in use at the time. We decided that the homeowner was aging. He needed central air conditioning, so we decided to put in a heat pump. That was about the exact same cost as repairing the chimney and wood stove. We also had to increase the electrical service for the increased capacity of the heat pump, and the owner agreed not to use the chimney. Next. Bathrooms and kitchens are priorities. We can't avoid fixing those. This again was the water damage pipes, and the ceiling above here is completely damaged. This is adjacent to the garage wall, so we will be replacing all of an air sealing around the entire garage. Next. This is the upper bathroom. You can see the subfloor is rotted out. There's leaking at the base of the toilet. We will be replacing the vinyl flooring, the toilet, and the subfloor. Next. This is in the kitchen, the exterior door to the deck. There's a hole right there. You can see that, and the entire floor system was compromised by the ongoing leak with the deck. Stove and range hood had to be replaced, and all the cabinets. Next. Now this job, we ran out of home funds in the county. We spread those out over 6 rehabs. At this time, the job cost to do everything on this house, including siding and windows, and the chimney, would have brought the job in at $135,000. The house is only worth $131,000. We didn't have the funding, so we had to pick and choose, and along with the homeowner, what the priorities were. Obviously, mold, water intrusion are very important deficiencies that need to be addressed. We got HPG funding through our planning district. It's only about $5,000. Luckily, we have a very good development team, and we get private funding through donations, and that filled the gap here. We only do a couple of these large rehabs per year, and I guess you can see why. The funding is the real constraint. Luckily, most material prices have kind of stabilized. They've come down a little bit, but labor has really increased over the last couple of years. Next, please. With the Johnson rehab, this was a 1925 house, and we did XRF testing. It had lead. It had a previous gut renovation, and they put masonite siding on, replaced the windows, all of the interior finishes, and sheetrock and electrical. So the only lead on this house was the soffit, the fascia, and the rear crawl space doors. If you'll note on the upper left side of the soffit, you can see a rotted area. That's a flat section of roofing. Next, please. Here's the rear. You can see the crawl space doors that need to be replaced. So we decided that we would go back, please. We were going to replace the roof, the siding, all the windows, do a lead abatement job, kitchen cabinets, subfloor repairs, all of the doors replaced, insulation, termite treatment. plumbing electrical repairs for a job of $77,000. Next. There's the rotted ceiling right there at that rotted soffit area. Just a flat section of rubber roofing that needed to be replaced. The door will be replaced. It's more of a custom size. And next slide, please. This is underneath the kitchen area. You can see water staining on the joists from a previous leak. The subfloor needs to be repaired. There is loose HVAC ductwork there. There's no insulation. The vapor barrier is incomplete. We were able to secure funding through our local energy alliance. They do our energy audits, and they have a grant funding through Dominion Power, which is helps fund these insulation repairs through the EPA. Thank you. Next slide. Can't mess around with carbon monoxide. The water heater chimney failed inspection. We had to replace that. That was about $1,400. Next. Clutter was also an issue here. This woman had previously, for the last 11 years, been a caregiver for her mother, her father, and her 3 brothers who had all passed away at this time. So she was still dealing with the aftermath of that occurring and just didn't get around to really taking care of her house. Next. You really can't enter a space like this. I was tripping over items, trying to do an inspection in this room. I tried to help the owner counsel her on how to collect her items up, put them in bins, get things kind of addressed. She's motivated to get this work done in her house as well. So she's been doing that. In fact, this job has started and is almost completed now. Next. So with this job, we funded it through the city CDBG funding. They had funding for only a couple of jobs. So we got $32,000 through that. It involves, dealing with the lead-based paint, historic review, and we have to address all of the deficiencies. With HPG funding on the previous job, we don't have to follow the housing quality standard, so we can pick and choose. Of course, when you use private funding, there are fewer strings as well. So with this job, we had to follow the HQS, so we had to do all of the deficiencies. We had to correct all deficiencies. When you calculate a lead abatement job, you calculate the lead soft costs and you deduct them from the total job costs. And that rehab hard cost number, if it's over 25,000, you have to do a lead abatement job. Now that number hasn't changed at HUD since Title 10 was instituted in '99, and that I feel is a real difficult. It creates a lot of lead abatement jobs that maybe perhaps we could do interim controls on. And it was really designed for apartments and the public housing. It wasn't designed, that number wasn't really designed for residential lead work. But in any event, we're a nonprofit construction company. We have our own crews. I'm a lead abatement supervisor. We are a lead abatement contractor and also RRP certified. That helps us keep the costs down, as well as we're control of the schedule too. So last year we served 195 people, 75 seniors, 45 children. We brought back about $500,000 to the local economy, 179 repairs, and 30% energy efficiency gains. Next. Next slide. Thank you. Reach out to me if you need to have questions answered.
Great. Thank you, Len, for your presentation. And next we have Brandon Kemperman from Seattle King County.
Thank you so much, Nicole.
I will stop sharing so you can share your screen.
Thank you. All right, should be able to see my screen here. All right, again, I'm Brandon Kemperman with Public Health Seattle and King County. I'm here to share some information about barriers and opportunities for the rural and frontier environmental health workforce. So just to kind of go over some information about the rural and frontier landscape with some statistics. there are 46 million people, or 14% of the US population living in rural areas. And the population in those areas is actually growing. So from 2020 to 2022, the population has increased 0.25%. So which also emphasizes why it's really important to have support and resources available to the environmental health workforce. With the semi-isolation and the greater distance that rural communities live away from services, those community members have to travel greater distances. And then the environmental health workforce or local public health employees also have to travel greater distances to provide services to those communities and individuals. Rural areas have similar or greater risk of environmental health hazards as their urban counterparts. And those residents tend to be older and poor and lacks access to adequate healthcare coverage or services. And there are 8.8 million people in the rural population living in poverty. And there are 29 million rural housing units, which includes both occupied and vacant housing units. And between 2010 and 2020, there's been an increase of over 400,000 rural homes. So again, emphasizing the importance of having support from local public health, environmental health professionals. And as far as environmental health issues in rural and frontier housing, so Romona and Len covered some of those issues, but these are just examples. There are numerous environmental health issues that rural and frontier communities and individuals are facing as far as housing. So examples are lead-containing paint damage and then potential childhood lead poisoning that may result from that lead-containing paint damage. There are clean water issues, so access to clean water, and then also carbon monoxide issues like Len pointed out. So maybe if a combustion source is not installed to code or to the proper standards, then that puts the homeowners and the residents at risk of carbon monoxide poisoning and health issues. Also fire and electrical hazards. So rural frontier homes may not be built to codes or standards, and so that increases the risk of fire and electrical hazards. And then also with water damage and mold is another issue. Private wastewater treatment systems, so on-site septic, or even the lack of waste management for rural and frontier homes can provide an environmental health risk. The lack of rental housing codes and the lack of code enforcement for renters, and the lack of code enforcement for renters is also actually an urban issue that some residents face as well. So not just a rural issue. And then also plumbing problems, which can lead to exposures to pathogens and then also mold and moisture issues as well. So these issues are more likely to be found in older and poorly maintained homes, but not all rural and frontier homes experience all of these issues. So keep in mind, this is just a list of examples. All right, and then going through some environmental health workforce barriers. So due to the fact that there are so many different environmental health issues rural and frontier communities face, the importance of supporting local public health and environmental health professionals is essential. The following are many examples of barriers that rural and frontier-focused environmental health staff are experiencing. There's been a historical lack of investment in local public health staffing that limits programs and associated services and interventions that can assist rural communities. Without proper funding for public health, there's a potential for increased risk of poor health outcomes in rural communities. Compared to urban local public health, rural and frontier are the least well-resourced, which hinders community support by local public health environmental health professionals. Higher staff turnover is also a historical problem in rural and frontier public health, which can disrupt services and operations that provide essential support to communities. And the loss of experienced staff can also mean the loss of meaningful connections and relationships in communities, which we know is really foundational and important in accessing the community and really helping them with their needs. Without proper funding and resources, environmental health staff are forced to become generalists. And in many EH issues, they may not have capacity or knowledge to specialize and really improve certain aspects of environmental health in rural and frontier areas. Because rural-focused environmental health staff may be generalists, they will need more training to fill knowledge and experience gaps. But with inadequate resources, they may fall short on receiving all of the training they need to round out the services they can provide to their communities. Another capacity and staffing issue leads to inadequate capacity for seeking and applying for competitive grants that would provide funding for essential programs and services or to start new and innovative interventions to support communities. Due to many historical injustices by the government in general, there's a lack of trust in the government, which results in hesitation or lack of reaching out to local public health for services that could potentially improve individual and community health. And then going back to the lack of capacity, so because of inadequate staffing levels and capacity issues, local public health, environmental health professionals are not able to build relationships and positively engage with their community. Building relationships with individuals and organizations in their community is essential to making progress towards health and well-being. And there are also increased threats from emergent issues such as heat waves, wildfires, and drought, which many parts of the United States have been experiencing in recent years. With limited staffing capacity and specialized knowledge due to resource constraints, environmental health professionals are unable to fully assist communities to prepare for, mitigate, and respond to these emergent threats, again, resulting in communities at risk of poor health outcomes. All right, so how do we solve this problem? So there are definitely some opportunities to assist the environmental health workforce. Increasing and sustaining funding for adequate staffing levels of environmental health professional positions in federal, state, local, tribal, and territorial jurisdictions. Full funding for federal, state, local, tribal, and territorial jurisdictions to establish and sustain necessary programs such as clean drinking water, waste management, healthy housing, climate impact preparedness that support environmental health in rural and frontier communities. Sustained funding to be directed towards capacity building and establishing best practices, including for emerging issues, for environmental health professionals, supporting rural and frontier communities. And a focus on increasing investments in public health to address the cascading climate impacts to the health and well-being of rural and frontier communities. Increase support for rural and frontier environmental health staff by ensuring those professionals have better pay, benefits, job satisfaction, and pride within their organization to reduce turnover and job stress. Standardized training and licensing for environmental health professionals working in rural and frontier communities. Ensure local public health staff have increased capacity to meaningfully engage with their local communities to build trust and understand their unique set of environmental health needs. And provide EH professionals the tools and knowledge to address health equity in their communities. All right, so I'll go through just a couple examples from King County, where King County has been able to successfully improve environmental health in our communities in King County. One of which is the Housing Repair Program. So this is managed by Clark Fulmer. I just wanted to highlight the good work that's been going on in the Housing Repair Program. So this program provides funding for housing repair services for low-income homeowners and special needs renters in most parts of King County. And these repairs include items such as a leaky roof or a new septic system, and then also emergency conditions which the homeowners may be facing, and then health and safety repairs or major building preservation issues. So to accomplish this, the Housing Repair Program provides a couple funding sources. So loans, they have the deferred payment loan portion, and then they have matching funds home repair loan. And then the Housing Repair Program provides grants through manufactured home grants, emergency grants, and then home accessibility modification grants for renters. There's a website for the King County Housing Repair Program, which includes a lot more information and ins and outs of the program and the ways that it helps low-income homeowners and special needs renters. All right, and then the other one is about a couple rural islands that are located in the western part of King County, out in the Puget Sound. So Vashon Maury Island is are rural islands that have a combined 51 miles of beach, which makes up 50% of King County's total shoreline. And then, you know, obviously with these being islands, there are limited resources, limited habitat. So preserving those resources and habitats is essential to sustaining the homeowners and residents of these islands. So many of these homes are not served by water districts, but they have private wells, and they also have on-site septic systems as well. So there's a couple different things that the homeowners need to manage to maintain their own comfort and then also maintain the water quality and habitats on the island. So King County, in cooperation with a number of residents and then also community members, developed a user's manual to protect the limited island resources. And the user's manual includes guidance that is provided to protect well water from contamination and septic system maintenance guidance as well. Tips to protect the island wildlife, wildlife control, native plant information so that invasive species can be eliminated, and then the native plants can be planted and maintained to maintain that native Washington state habitat. And then also the user's manual includes a checklist for homeowners and landowners and managers to ensure that they have the tools necessary to help protect those resources. And this information is also included on the King County website and can be found there. All right, and that is it for me. Here's my contact information in case you want to get in touch. And our website is kingcounty.gov/health and references. All right, I will hand it back over to you, Nicole.
Thank you, Brandon. All right, everyone. So we will open up the floor for questions. I see that we do have some in the Q&A. So we just open that up. All right, let's see. Brandon, I'm going to pose our first question. Oh, and presenters, you could go ahead and turn on your cameras and unmute. Are tribal communities also considered rural?
Yes, that's a great question. And yes, tribal communities are considered rural, and they can be considered rural. And there's actually, it's interesting, there isn't just one definition for rural or frontier. Depending on the government agency, they have different definitions of what rural is and how they calculate those different population densities, etc. So that definition definitely depends on which government agency is collecting that data and reporting it out. So hopefully that answers that question.
Yes, thank you. And for Romona, is the lead blood levels a result of paint or the 15 ppbs of lead found in drinking water?
Is that question for me?
Yes, Romona.
Okay. The majority so far, we did get the Mississippi Department of Health. They did do a study, and the majority of the exposure, the mediums, is paint, right? But we are also, of course, you know, in the city of Jackson, we've had a major water crisis. And so there in the city of Jackson, it is coming from both paint and water. Up in the rural communities where our work is centered, where we started, the housing stock is so old that we are looking at, and the counties that we are piloting the Mississippi Zero Lead and Healthy Housing Initiative is in Montgomery, Grenada, and Yellow-Bush counties. And we selected those counties. First of all, MCUP is our rural office is up in Montgomery County. But the primary reason why we selected to pilot the initiative in those counties is because they had higher exposure rates and also higher elevated blood levels. And so we're focusing more on, we will be testing for water, soil, and also for paint.
Great, thank you, Ramona. And for Len, regarding repairs on one of the homes that were very extensive, how many people are you able to serve annually with safety home repairs?
So, see, I think on the last slide, I had some stats on that. This past year, we served 195 people, and that is 92 households. And so that's 75 seniors and 45 children, 179 repairs, rehabs, and energy retrofits. So we do large jobs. We do fewer of those per year, obviously, for obvious reasons. Money is the biggest hurdle.
Yeah.
But then, funding requires that we repair all deficiencies. Some of the federal funding requires that. So we fill the gap with our great development team and how they are able to fundraise. Charlottesville and Albemarle County are fairly wealthy counties. So we're lucky that our Board of Supervisors and it supports our mission and operating expenses. And then we also have a great social media team and a development team that does a lot of fundraising with foundations. We get large grants. We also have a septic to sewer program that's in place that the county used some ARPA funds to start. And we are helping low to moderate income families who are in the sewer jurisdiction to then get connected. And that has proven to be a big environmental benefit.
What an impact. All right, Brandon, does your team work with community health workers to build relationships and assess needs?
Oh, yes, excellent question. We absolutely do. That is an essential part of actually getting things done in the communities, working through community health workers, and then also working with community-based organizations, because you really need to form those relationships, and that's how you can get into the community and work with them and build that trust. Working with community health workers and CBOs is really how you can also understand what the needs are of those communities and how you can best answer those questions, and then also provide resources that are needed. So we definitely love to break down silos, and we like to work with the community and really get a good understanding of what their needs are. So yeah, that's a great question. Thank
you, Brandon. Ramona, I am going to ask you this question. It kind of goes along the lines with the lead.
Sure.
How is it delineated where the source is coming from? If it is found in water, my thoughts are that the lead ingestion is more likely from water by mouth and skin than from paint.
I'm going to say that you're probably correct, that it is coming more from the water. Although in the study that the Department of Health conducted, they really weren't very specific on what the medium was and where it was coming from. So from a safety perspective, we're just looking at, we're going to test for water, we're going to test for paint, and we're going to test for in the soil. And wherever we get those positive results, that's where we're going to mitigate.
Yeah, that sounds right. Thank you, Ramona.
Thank you.
Len, back to you. For home repairs, are liens placed on the homes to recoup some of the costs if the owners decide to sell the home?
Yes, absolutely. We have a 10-year deed of trust. Some funding sources, that's a diminishing deed of trust. That's also could be tied to their ability to make payments. Sometimes they have a small fee of $25 a month to pay or something like that, if they can afford even that. Um, but generally, it's a 10-year deed of trust and it vanishes at the end. And obviously, I tell all the homeowners that, we're not in the business of taking anyone's house. This is a grant-funded program, and it's just there so that we want to help people who are going to stay in their homes. It doesn't mean you couldn't do something like refinance or transfer, but you just have to pay that part back and it will go and help another family. So it goes back to program income.
I see. Great. Well, thank you. Thank you all for your questions today. To stay on track, we are going to go ahead and move on. Our presenters can continue to answer your questions in the Q&A box. And let me share my screen. All right. So now I am going to pass it over to NCHH's Senior Program Analyst, Christopher Walker.
Thank you, Nicole. We wanted to, and thank you everybody for attending this webinar. Wanted to share some opportunities and resources that we partner with NCHH to put together some resources targeted to environmental public health and healthy housing professionals working in rural frontier communities. We identified that people spend a large amounts of time in their homes, and we want to make sure that we empower the workforce with the tools and resources to effectively protect public health of residents living in those homes. So we put together two resources. One is a guide for working and addressing the needs in rural and frontier communities. And then another one just dealing with strategies to leverage technology. So we'll talk about those going to the next slide in a little more detail about what you can expect. So with the guide itself provides details on some of the most common environmental public health and healthy housing concerns identified among rural and frontier communities, such as indoor air pollution, mold, vacant homes, access to available resources, things of that nature, and some of the associate barriers faced by the workforce. It provides tools for and examples of intervention strategies and best practices that practitioners can implement to address a range of concerns, reduce risks, increase safety, and improve public health outcomes for rural and frontier communities. Things of who do we partner with to protect public health? What other programs conduct home visits? How can we collaborate to bring potential hazards to the attention of environmental public health professionals? How do we make sure the community sees us as a resource and not someone to point out issues with their home? Next slide. We have another opportunity where we talked about leveraging technology, where we want to make sure that we're taking the information to be able to allow the workforce to work effectively and efficiently, being mindful of accessibility and scalability of services in rural and frontier communities. So we're mindful of certain software applications to consider if the internet access isn't great, the ability to use field clients to be able to conduct assessments or inspections, but also if you have communities that may have access to a strong internet connection, the ability to consider virtual home assessments. And each topic has a description. It also comes up with examples to consider, and then the benefits and limitations of both. So we're very happy about the resources. We're very happy about the work that we've done with National Center Healthy Housing. And we have your emails of those that have registered for this webinar in the very near future. Once these resources become made available to the public, we will share the information directly with you. We'll have it housed on both web pages, but to make sure that you have the access that you don't have to go to web pages, that we'll send that directly to the emails that we receive from those who registered. So we're very happy about this. Thank you once again to National Center for Healthy Housing for the work that we've done together on trying to help support the workforce and protecting those living in the rural and frontier communities. So I'll hand it back over to Nicole.
Great. Thank you, Chris, for sharing this exciting news for our workforce who work in rural and frontier communities. In closing, we would like to thank our guest speakers for their presentations today. Romona Williams from Mississippi Communities United for Prosperity, Len Wishart from Albemarle Housing Improvement Program, and Brandon Kemperman from Public Health Seattle and King County. And to all of you who joined us today, we thank you. Please do take a few minutes to complete today's webinar evaluation survey, which you should receive following the conclusion of the webinar. And thank you again for attending our webinar, Improving Outcomes in Rural and Frontier Communities. We'll see you again soon. Have a wonderful rest of your day. Thank you.